Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the today's class, we are going to discuss most important questions and updates that is much necessary for you all before going to the main exams. Students, in the first four sessions, I have covered lot of the important questions that is from the very high yield topic, the trending topics, the new guidelines, the important updates, the WHO guidelines, CDC guidelines, everything. And in the last class also we have discussed most of the important questions on the hospital acquired infections, which is the criteria to say this is the hospital acquired infection and what are the types of the hospital acquired infection, where we have seen the surgical site infections, central line associated bloodstream infections, and COUTI. And most common cause of the hospital acquired infections, what is the second most common cause of the means causative organism of the hospital acquired infections, everything we have seen in detail. Again, in this today's video also we are going to discuss most important questions that is much necessary to you all before going to exams. Okay, so what you people have to do is to take a note of the every point what I am telling here and make a revision immediately after class. Okay, so don't forget, as you know that champion will not only learns the skill, so learning the skill and practicing the skill repeatedly makes you a real champion and it keeps you a consistent achiever, right? So without wasting the time, we will start at today's class, right? And if anyone of my students are watching new first time, and if you are new to the Master Nursing Classes family, so please do subscribe to the channel and hit a like button. And if anyone is watching repeatedly still didn't have subscribed to our channel, if you found the content is healthy, the content is quality, the content is rank deciding, so please do subscribe to the channel and hit the like button. Your one like matters us a lot, bachu. Yes, if you are just watching the class and leaving the class means like we don't understand what happening. If you are liking the class, so we will work hard more to give the content, right? Yes, without wasting the time, we will start the class and with a beautiful motivational quote. Don't blame the don't blame the distractions. Just try to improve your focuses. But you nowadays, if you goes out, just you keep stuff out of your home, there is some attractions which attracts you. That may be a shopping, that may be a movie advertisements, that may be a music advertisements, that may be a programs where you will be seeing everywhere posters. Because nowadays the attractions are lost. So those unnecessary attractions make you a distraction. So don't blame that. Try to improve your focus. What you have to do today, it should be planned yesterday only. So then only your next day will be a very quality one. Okay. Yes. With that one, we'll start now with beautiful update. That is the in the last 2024, 12th May of the 2024. Yes. In the 12th May of the 2024, we have celebrated the International Nurses Day. So the question will come when we have to celebrate the International Nurses Day, 12th May of the every year. Okay. And there the theme is in the last year theme, that is the 2024 theme, our nurses, our future, the economic power of the care. So this is the theme of the last year 2024. Okay. Very important. This is every year organized and celebrated by the International Council of the Nurses. It's very important. Who organizes the International Nurses Day? That is the International Council of the Nurses. Very, very important. Okay. So this was the theme of the last year. Then comes to the this year, 2025. This is again given by the International Council of the Nurses. Here, again, the theme is our nurses, our future. The tagline is different. The caring for nurses strengthens economics. So this is very, very important. Just small differences there, bacho. It will comes in your exam. This is we are going to celebrate on the 12th of May 2025. Right? It's important. Make a note of it, take a screenshot of it, and revise immediately after the class. Okay. So and here's the first MCQ in front of you people. Yes, try to give the best answer for this multiple choice question here. What is the minimum bacterial count required to positive urine culture to meet the CDC criteria of the COUTI? So what is COUTI? In yesterday class we have seen the COUTI is the catheter-associated urinary tract infection. Okay, so this is the most common hospital-acquired infection and most common cause for the COUTI. We have seen that is the E. coli is the uh, most common cause for the our urinary tract infection. Here it's in catheter associated urinary tract infection. So to diagnose this one, we have to send the investigation of choice. That's the urine culture. Okay, in the urine culture, how much bacterial load if we are getting means that we can say it is a positive urine culture. Normally in the urine, bacteria will be there, but it should be a more than a certain extent. There we have to say the bacterial load is more means it is an infectious one, right? So what is the that criteria? Yes, if in the 1 ml of the urine, the bacterial load which is coming 10 to the power of 5 and more. So this is called as the positive urine culture, and it is very, very important. Then we have to say the patient is suffering with the catheter associated urinary tract infection. Okay. So here mostly at least two species we have to see. Okay. Like E. coli and Klebsiella, at least two we have to identify. Among those, any of one, at least E. coli or Klebsiella or any other bacteria should be more than 10 to the power of 5 colony forming units. CFU here as a colony forming unit for 1 ml of the urine. So this is the diagnostic criteria to diagnose the COUTI, which is given by the CDC. What is the full form of the CDC? CDC is the Center for Disease Control. What it is? It is a Center for Disease Control. Okay, important. Just make a note of that one. And here is the complete criteria for diagnosing the COUTI. It is very, very important, bacho. This word, there is the costovertebral angle pain and tenderness. This was the your ESIC, UPSC, ESIC conducted exam. You people know that in that one, this question came. The CDC guidelines to diagnose the COUTI. Okay, this is very, very important. And nowadays, the AIMS is also focusing on the guidelines. So it's very important to know the guidelines. So avoid the confusions also in the choosing the options. Okay. Yes. Yes. What is the clinical criteria? Clinical criteria should be after insertion of the catheter, it should be passed more than 48 hours. Okay. If it's happening within 48 hours, that is not associated with the catheter. That is associated with another thing. Okay. The urinary tract infection should be happens after 48 hours of insertion of the catheter. Okay, and must at least one of these following symptoms should be here. Okay, so that is the fever of more than 38 degrees Celsius or 100.4 degree Fahrenheit and suprapubic tenderness. What is the suprapubic tenderness? Suprapubic tenderness is very simple, bacho. The tenderness at the suprapubic region. What is the suprapubic region? As all of you know that. So this is the abdomen, and here is the umbilicus, and here is the thigh, right? And here is the genital area, right? So it's just below the umbilicus and above the genital area. This particular region, what I am highlighting here with a green pen. So this particular region we call as the suprapubic region. Here the patient feeling the tenderness. So that is also indicating that yes, the patient is suffering with the urinary tract infection. Okay, it's very, very important. And new or increased confusion or agitation, especially in the older patients. Very, very important. So this is the clinical manifestation of the urinary tract infection. Most important. Most important. Along with this, the patient may complain of the increased frequency of the urine, increased urgency of the urine, and increased pain during the urine. That is a painful urine dysuria. Okay. Yes, urgency, frequency, hesitancy. That may we can see in the yes. We can what we can say the prostatic enlargement. Okay. So there also we can see, but that one also we can see in the COUTI. It is not included in the diagnostic criteria. Look at this one. Fever will be there. Suprapubic tenderness will be there. Costovertebral angle pain and tenderness is there. And new and increased confusion and agitation also will be there. And when we will check the laboratory diagnosis, when we will check the laboratory diagnosis, when we will send the urine to the microbiology lab, there the bacterial load should be more than or equal to 10 to the power of 5 colony forming unit per 1 ml of the urine. This is very important. Bacho, it is most important. Okay, so here is the next question. Try to read the question completely and try to give the best answer for this one. What is the term for a thin, clear, watery discharge from a surgical site typically seen during the initial healing phase? Okay, so just the patient came from the like OT, and it is the initial healing days of the patient. Okay, the patient is in the post operative area. When you will go and see the around the surgical site, you will see some clear fluid coming from the clear, thin, and water fluid coming from this surgical area. If it is thin, clear, and water discharge, we can say that one is in the serous discharge. It's a serous discharge, right? So this is the correct answer. If in case from this surgical site, the yellowish, thick pus filled which is coming, the yellowish, thick, and pus filled which is coming means which we call that one as in the purulent. We call that one as the purulent. So in the question that one not asked, so I am eliminating this one. And if in case the examiner is given the clear plus pink or red color discharge, means here the clear also there and some blood also there. So this indicates clear means serous and blood means sanguineous. So the clear plus pink will be there means that is the serosanguineous discharge. Okay. So here the only examiner given the clear, thin, and watery. So this is clear, thin plus blood. So that is the serosanguineous. I am eliminating the option C also. Then came to sanguineous. Sanguineous means it is completely red. Okay, and which indicates the bleeding from the surgical site. Which indicates the bleeding from the surgical site. Very important, bacho. Okay, so let's come to the next question. This one. Consider this one as in the 10-star question. Very important. So which of the following Foley's catheter size is typically used for an adult female? Look at the question what examiner actually asking. Okay, in the adult female which we can use. Yes, very important one. Please try to give a response and answer to this question. The size of the catheter in the adult female. The size of the catheter in children is 10 to 18 French. The size of the catheter in the adult female that is the 12 to 14 French. The size of the catheter in adult male, that is the very important 14 to 16 French. Then the size of the catheter in the newborn, we can use the 5 to 6 French. Sir, I want one answer. I want one answer in the children, I want one answer in the adult female, and I want one answer in the adult male. Here you have told in the range, sir. Bacho, in the yesterday's class, I have given you a clear that this is updated point also. I have told that use smallest appropriate catheter always. So this is the given in the Cauty bundle care also, and this is said by the CDC also. Okay, so if we are using the smallest appropriate catheter of that age, so that we will avoid the urethral injury. If we are avoiding the urethral injury, means there is less chance of the urinary tract infection. So if you want one answer to choose, means choose the smallest one. In the children, 8 French is the good catheter. In the female adult, 12 French is the good catheter. In the adult male, 14 French is the good catheter. But when it comes to the range, this is the range. Okay, very important. And in the exam also, range only it will be asked. Okay, most important for you all. So in the exam they have asked the question, they have asked for Foley's catheter size for the adult female. So our best answer is the this one, that is the 12 to 14 French is for the adult female. Very important. This is the 10-star MCQ. It will come in your exam. Okay, so and in yesterday's class I have, while telling this one CDC Cauty bundle care, so I have told one word Okay, that's the where there is the position of the catheter and a drainage bag. So this position of the catheter and drainage bag, one clinical scenario based questions will come. So in the question also I have told where we have to position the urine bag, means almost there was option like we have to place it in the, okay, we have to place it in the below the level of the bladder. Okay, consider here is the patient, he is sleeping now. Okay, so the urine bag should be here, this is the catheter. Okay, and this should, here it should be our urine bag, means it is always below the level of the bladder. If we are lifting above the level of the bladder, means the urine will backflow happens, the backflow of the urine increases the risk of the catheter associated urinary tract infection. Okay, which increases the risk of the our catheter associated urinary tract infection, most important. And this is the basic we have studied. But one more question it will come, sir, what is that? So consider this is the patient, this is the patient who is sleeping in the post operative ward. Okay, and just patient came from the OT. Okay, and just he is recovering from the general anesthesia. Okay, because of the general anesthesia his bladder tone is completely lost and urine is not coming out. So that is what we call as the retention of the urine, and now the bladder is completely full and bladder is completely distended. Now bladder is completely full and distended. Okay, so now what I have to do? Now I have to do the intermittent catheterization. Means I have to insert the catheter inside and to remove the and drain out this bladder, because the patient will complaints of the pain in the lower abdomen because of the distended and completely full bladder. So at this point of the time, if I am inserting the catheter and keeping the bag down, means suddenly the bladder will get empty. So which may leads to the bladder will get collapse. So in order to avoid that one, so we have to keep for initial empty of the urine bag at the level of the bladder. Okay, so in the post-operative patient, to relieve the distended bladder in the post-operative patient, initially we have to keep the urine bag at the level of the bladder. Okay, once it's empty, because the urine bag is not below, means it will not means it is not below, means it will not suddenly collapse. If it is below, means the urine will suddenly comes down and the bladder may get collapse, right? So initially we have to keep at the level of the bladder, then after that we have to come to the, yes, lower than the bladder. Okay, this is the clinical scenario based question. Okay, mark the answer at the level of the bladder if they have given the scenario like the patient is in the post operative ward recovering from the general anesthesia. Because of the anesthesia bladder is completely full and distended. So to relieve the post anesthesia bladder distension, where we have to keep the urine bag, if like this complete scenario question is coming, means then choose at the level of the bladder, otherwise always your answer would be below the level of the bladder. Okay, hope this clinical and scenario based question is clear for you all. Okay, so the next question is here. Okay, identify the image, identify the image, identify the image. Yes, this is the Foley's catheter, this is the Foley's catheter. Bacho, for how many days we can use this Foley's catheter? Your answer would be 14 days. For how many weeks we have to use the Foley's catheter? Your answer would be 2 weeks. Same question, different answer. Okay, the same answer only in the form of the days and weeks. Okay. In last, while telling the size of the catheter, I have told the French. Okay, so for the female, we told 12 to 14 French. So, what is the meaning of this French? This French means the question will come whether it may be an internal circumference of the catheter or it may be an external outer diameter of the catheter. Yes, the French here is the outer diameter of the catheter, not internal. Okay, so this is the outer diameter of the catheter is the what we call as the French. Okay, French here is the outer diameter of catheter. So this question may comes in your exam. Okay, because this one last one time they have asked in the exam. Okay, the French stands there as the outer diameter of the catheter. Then identify this one, important one. Yes, this is the silicon urinary catheter. This one is the silicon urinary catheter. So for how many time, how many times we can use this one? Sorry, for the what is the duration of the time here we can use the silicon catheter? Yes, we can use this one for the 90 days maximum, and for the we can say 3 months maximum we can use the silicon Foley's catheter. Very important, bacho. Okay, right? It's very important for the long duration. We have to use the silicon catheter. The image based questions will come in your exam. Okay, the image based question may come in your exam. Very important, right? So this is the balloon where we are inserting the fluid from the external lumen to inside the balloon to keep the balloon in the bladder and to prevent the expulsion of the Foley's catheter. Okay, so this is the bladder. Consider we have inserted the catheter like this. If the balloon is inflated here, means the bladder will not come. This catheter will not come out. So that is the reason to prevent the expulsion of the catheter. We are inflating the this balloon. So question will come when we have to inflate the balloon. Means we have to insert the catheter 4 centimeter after initial coming of the urine. Okay, so while you have inserted the catheter, okay, urine came, then again we have to insert the catheter at least 2 to 4 centimeter inside, then inflate the balloon. Okay, sometime what happens, this is the urethra and you are inserted the catheter like this. Okay, so the urine will come but the catheter is still in the urethra. If you are inflating the balloon in the urethra only, means it will rupture the urethra. So that is very dangerous. Okay, so always this balloon should be inflated in the bladder, and the question will come. So what fluid we have to inflate this one? So always in the option normal saline and distal water will be there. So always choose for the distal water, because sometimes in the normal saline, as all of you know that the sodium chloride is there. So this sodium chloride may forms the crystals and salt inside this one. So if it forms the crystals and salt inside, while removing we are unable to deflate the balloon. Okay, that is the dangerous. Okay, if in case the crystal formed and we are unable to deflate the balloon while removing, means what is the next option? We have to go for the USG guided rupture of this balloon. Okay, so how means we have to take the patient to the USG room. We have to keep the USG probe and identify where the balloon is, and with the help of the external needle we have to decompress this particular balloon and we have to rupture that balloon and we have to take that particular catheter out. Okay, so that is the very important. The USG guided decompression of the balloon will be done in case of the formation of the crystals and if the balloon is not deflating. Okay, so that is the another question that may strikes in your exam. Very important. Then identify this particular catheter. Yes, this is the 3 lumen bladder irrigation catheter, or you can say urinary catheter. Okay, we can say this one is in the 3 lumen bladder irrigation urinary catheter. So these 3 lumen, first, second and third. Okay, here this particular lumen we have to use for the drainage of the our urine, and here this particular balloon we have to use for the instill the fluid inside the bladder. Okay, and this one for the inflation of the balloon. Okay, so why we have to put the fluid inside? Means there are some cases like TU, RP surgery. Okay, there is the transurethral resection of the prostate. Okay, in case of the benign prostate hypertrophy, so where we have to do the surgery, that is the TURP surgery. In TURP surgery, there is chance of the retention of the clot inside the bladder. So to bring that clot outside the bladder, we have to irrigate the this one. What we can say the bladder. Okay, in the bladder irrigation, we are using this 3 lumen catheter. The use may also comes. There is a 3 lumen catheter used for the bladder irrigation after the TURP surgery. Okay, it's important for you all, right? So here is the next question. What is the next question? What does the term virulence refers in context of the pathogens? So when studying the pathogens, the disease causing organism, what is the word virulence meaning here? Option A is telling the ability of the pathogen to cause disease. The ability of the pathogen to cause disease, this is called as then the pathogenicity of the this particular organism or the pathogen. Okay, this is what we call as the pathogenicity. Pathogenicity. Okay, so pathogenicity is the ability of the organism to cause the disease, right? So then what is the meaning of the virulence, sir? I will teach, don't worry. Then option B is telling it's in recognizing and attaching antibody to the pathogen. What it is telling, the antibody is there and this is the pathogen is there. Okay, consider this one any kind of the bacteria. So this is our antibody. Our antibody identifying this is a pathogen and it is attaching to the pathogen. So identifying and attaching to the pathogen, which is called as in the opsonization. We call this one as in the opsonization. Okay, this is not virulence. Then comes to the option C, that is the ability of the pathogen to cause the severity. Yes, virulence is the ability of the pathogen to cause the severity. If the bacteria is having the more virulent, means we can say which can cause the more dangerous and more severe disease. Okay, less virulence bacteria causes the less severe disease. Okay, so the answer is the ability of the pathogen to cause the virulence, to cause the severity is the our virulence. Okay, so the last option is the process of destroying the pathogen with spores. So we can do this one in the yes autoclave process, autoclave sterilization, right? So this is the very important. And one more word it will come, that is the attenuation, where we are reducing the disease causing ability. Okay, so we are reducing the disease causing ability of the our pathogen. Okay, so consider this is the pathogen which is having the more disease causing ability. Okay, here we are reducing disease causing ability of pathogen. We are decreasing, means for this word we call as the attenuation. So why we have to reduce the disease causing ability? So we can use this one as in the vaccine. If we are reducing its disease causing ability, so we can use this one as the vaccine. Okay, this particular bacteria what it is there, the pathogen, so that one we can use for the formation of the vaccines. So that is what we call as the reducing the disease causing ability of the pathogen is what we call attenuation. Very important. Okay, so here is the next question. What is the most common cause of the surgical site infection? In yesterday's class already discussed the question, but that question was different. There also I have told the most common cause of the surgical site infection. Okay, again I am repeating here because it is very important. The staphylococcus aureus is the most common cause of the yes the surgical site infection and central line associated bloodstream infection. The SSI and CLABSI is very important. For this CLABSI also we can call as the catheter related bloodstream infection. Okay, so this is also both same only. The most common cause for this both will be the staphylococcus aureus. Okay, and E. coli is the most common cause for the yes our CAUTI, catheter associated urinary tract infection. Okay, Pseudomonas aeruginosa, the most common cause for the ventilator associated pneumonia. Okay, so these all are the types of the hospital acquired infection, the CAUTI, CLABSI. Okay, and what we can say VAP and surgical site infection, most important. And Clostridium difficile, this is the second most common cause of the causative organism which causes the hospital acquired infection, and most common organism which causes the hospital acquired infection is that is healthcare associated infection is our staphylococcus aureus is the first most common, and Clostridium difficile is the second most common. It's very important. Okay, so the next question is, which of the following is not a part of the surgical site infection bundle care? Okay, for the prevention of the infection. Okay, again the hot question, make a 10 star for this one. Very important. Okay, while explaining and while giving the rationale, take a screenshot of that one and revise immediately after the class. Okay, so which of the following is not a part of the surgical site infection bundle for the prevention of the infection? Okay, so option A is the proper hair removal with clippers instead of the razors. So this is the very important point. If you want to remove the hair from the site of the surgery, don't use the razor, use the clippers. Okay, very important, very important, right? Okay, so it's a correct statement. So it is not here the question asking not a part. Okay, this is a part or this is the correct statement. Okay, then option B is telling prolonged use of the broad spectrum antibiotic post surgery, but you know the guidelines says that you have to stop antibiotics within 24 hours after surgery. Okay, so we have to stop the antibiotics within 24 hours after the surgery. Most important here, the word telling us in prolonged use. No need of the prolonged use. So this is a correct answer because in question they have asked not a part of the SSA bundle. Okay, so the option B is not a part of the our SSA bundle. So I am highlighting this one and this is the correct answer, right? So this one is the correct answer. Then comes to the option C, what it is telling, use a sterile technique during the procedure. Yes, it's absolute part of the SSA bundle. Okay, there is a surgical site infection prevention bundle. So this is very important. Sterile technique should be must be used in the OT, and sterile gloves, sterile field, sterile draping. Okay, everything will be sterile, and there we have to perform the surgical scrub hand washing for the duration of the 3 to 5 minutes, and the single best answer is the 5 minutes. Okay, so then comes to the next option, there is the appropriate skin antisepsis before the surgery. Most important bacho. So before the surgery we have to go for the part preparation. Okay, so part preparation will be done for the chlorhexidine plus iodine. Previously used one is the iodine, now in trending and used in the OT is the chlorhexidine solution because it's a very effective one. Okay, so most important, go for the surgical site preparation before taking the incision with the help of the chlorhexidine and iodine antiseptic solutions, most important. Okay, so then comes to the actual surgical site infection prevention care bundle. Here we have to give the antibiotic prophylaxis before the surgery. Okay, the question will come, how much hour before the surgery? For all the antibiotics, 60 minutes before the surgery we have to give. Okay, for the vancomycin, only one drug. For the vancomycin, till 120 minutes we can give before the surgery. Okay, and if the surgery is duration of the surgery is more than 4 hours, repeat the antibiotic. Repeat the antibiotic. This is what guidelines says. Okay, so antibiotic prophylaxis should be given 60 minutes before the surgery, and vancomycin we can give 120 minutes before surgery. Okay, only vancomycin, and except all antibiotics we can give 60 minutes before the surgery. Okay, and if the duration of surgery is going more than 4 hours, repeat the antibiotic. This is the most important. Then comes to the maintenance of the normothermia. Most important, that is the maintenance of the normothermia, because preoperatively, intraoperatively, postoperatively, the patient temperature is low, means increased risk of the infection will be there. So the maintenance of the normothermia and prevention of the hypothermia is the most important thing to prevent the surgical site infection. Then proper skin antisepsis, as I told in the last one only, before doing the surgical incision we have to use the antiseptic solutions, where we are using the chlorhexidine solution and iodine based solution to prepare the surgical site. Okay, so then comes to the appropriate hair removal. The best method I have told, use the clippers and don't use the razors. Okay, very important. Then sterile wrapping of the sterile wrapping and sterile techniques we have to use complete surgical scrub, and along with that we have to cover all extra part. Consider you are taking, this is the umbilical, you are taking incision here. Okay, this part only should be exposed and rest all should be dropped with a drop towel. Okay, so this will be very important. Only the surgical part only exposed and rest all we have to cover with the drop sheet. Okay, so then comes to the glycemic control, most important bacho. As all of you know that the bacteria loves the glucose. If the patient is hyperglycemic in the post-operative area, the patient comes with a surgery to the post-operative area and his blood glucose level is the 250, 300, 350. Means there is increased blood glucose level is there. So the bacteria may grow and bacteria can grow very easily and bacteria can develop very easily and surgical site infection risk will increases. So always keep the glucose under control. Okay, so it should be always between the 70 to 100, so not more than that. Okay, very important. Then comes to the proper wound closure. During the surgery we have to surgeon have to close the wound properly. Okay, there should not be any edge. Okay, and there should not be any opening like this. Okay, it should be properly closed. Okay, like this. Okay, it should be properly closed. Both surgical ends should be properly closed. If you found any opening, so you can inform the surgeon, so you can restapple that one. Okay, so then comes to the post-operative wound care. Okay, post-operative wound care, most important bacho. So here we have to promote the wound healing things. Okay, so promote wound healing. Promote the wound healing. From here question will come. How, sir? I will tell. Just wait a second. Okay, so how we have to promote the wound healing? First, you have to ask the patient to stop smoking and alcohol. Stop. Why? Because smoking causes the vasoconstriction, and this vasoconstriction decreases the blood supply to the surgical site. So decrease the blood supply means no healing will be there. Very important. Then comes to the next one. Give the vitamin C. That is the collagen synthesis vitamin, or we can say vitamin of wound healing. That is the vitamin C, which increases the collagen synthesis. Means wound healing will be happens very fast. Very important. Then give the high protein diet. This high protein diet helps for the closing the wound bridge. Consider here is a wound and inside the wound there is a gap like this. Okay, in order to prevent fill this gap, so we have to give the high protein diet. And the one important and most important metallic agent where we are giving is the zinc. Okay, so zinc also increases in the wound healing. Very important. Zinc, high protein diet, vitamin C improves the wound healing, and make sure that this all should be going to the patient in the post-operative area. Okay, and we have to ask the patient to stop the smoking, which promotes the wound healing very importantly. Okay, so then comes to the next question. In the surgical site infection, we are having the three classification. One is superficial surgical site infection, one is deep surgical site infection, one is the organ and space surgical site infection. As we have studied the criteria of the surgical site infection, the surgical site infection is the infection after the surgery within 30 days is our main criteria. But in case of the deep incisional SSI and organ or space incisional SSI, we have to consider that is within 90 days also we have to consider in this one. But the superficial should be considered that is within 30 days. Okay, so let me revise this one. What is the superficial incisional surgical site infection? At the site of the surgery, infection happening only in the skin and subcutaneous tissue. The infection is happening only in the skin and only in the subcutaneous tissue. That is called superficial incisional surgical site infection, which is we will consider it happening within the 30 days only. Okay, so deep incisional surgical site infection is in the muscle and fascia is involved, so we call that one as the deep SSI. Okay, which will be within 90 days. Okay, so the range will be given here as 30 to 90 days. Okay, then the organ or space SSI, which will be happening within 90 days. Very important, bacho. So this is all and very important points related to our surgical site infection. And before going to the next question, here is one beautiful advertisement for you all, right, related to the information on the test series. Bacho, if you are preparing for both Norcet and RRB, go for the Sure Selection Test Series, which will be considering both this combo. Okay, we will be getting the test paper for the Railway Recruitment Board Nursing Superintendent exam also and Nursing Officer exam in the AIMS also, that is the Norcet exam and RRB exam. If you are only preparing for the Norcet, then no worry. So we have plan for that also. Okay. Go for the Norcet special series. Okay. So that is the Norcet special series. Sir, I am not preparing for Norcet, just I am preparing for the RRB because of the age related problems. Sir. Okay, no problem, dear. For you also, we are having a good plan, that is the Vande Bharat test series for the RRB special. Okay, so this is including the entire RRB syllabus here in the sure selection. Complete RRB syllabus plus Norcet syllabus covered. For the Norcet, only complete Norcet syllabus is completely covered here. Okay, so if you are interested, you can go for the our test series. Sir, where it will be available? It will be available in the Master Nursing Classes app, which we people can download from your Google Play Store. Just go to the Google Play Store, type Master Nursing Classes, download our app, and practices the best quality test series which are prepared by the expert nursing officers, where they have recently passed 6 to 8 exams in the all state and central governments. Okay, so they are only giving the rationale, they are only preparing the question. Okay, so very important. If people want a rank, means just join to our test series and practice this on daily basis, and revise the rationale immediately after submitting the your tests. Okay, very important. So for the download purpose, I will give the link in the comment box also, and I will give the link in the our description box also. Don't you have to worry about that links. Okay, and for beautiful quizzes also going in our Telegram group, and question discussions, doubt discussions are going in our WhatsApp groups. If you want, I will drop a link of the WhatsApp group and Telegram group in our comment box. Okay, do join to our Telegram group and WhatsApp group also. Stay connected with the Master Nursing classes. Okay, so here is the next question. Which of the following is an appropriate intervention to reduce the risk of the ventilator associated pneumonia? Very important. Ventilator associated pneumonia. What it means, sir? It is meaning here simple and very simple. Just I will tell the criteria to say it is a ventilator associated pneumonia. Then we will go for the all things related to ventilator associated pneumonia. So this is a patient, okay, and it is the oral cavity, nasal cavity. Just from the oral cavity, we have inserted the ET tube inside the trachea. Okay, inside the trachea, we have inserted the endotracheal tube. Okay, and we have kept the patient on the mechanical ventilator. Okay, so now from this ET tube, the bacteria is going inside, or the patient is aspirating the fluid or content, means in the patient lungs, the thing will go directly here, right? Because of this, the infection and inflammation and the congestion of the lungs are happening. That is what we call as the pneumonia. Infection, inflammation of the lung parenchyma and congestion of the lung, we call the pneumonia. This pneumonia happening because of the ventilator and ET tube insertion. We call this one as the ventilator associated pneumonia. Sir, when we have to diagnose the ventilator associated pneumonia? After 48 hours of putting the patient on the ventilator, the sign of this pneumonia is generated after 48 hours of the intubation. So we call that one as the ventilator associated pneumonia. Most important. Okay, so the question is, which of the following is in the appropriate intervention to reduce the risk of the ventilator associated pneumonia? Okay, because of the ventilator, there is risk of the pneumonia is there, means as a healthcare provider, we have to reduce that risk. Means we have to take some preventions, some interventions to reduce the risk of the pneumonia. So what is that preventions we have to take? Just do drop your answer in the comment box. Right. Right, we'll start. Okay, so the correct answer is option A is telling here the oral chlorhexidine mouthwash. Yes, what option A is telling? We have to give the mouthwash with the oral chlorhexidine solution. Option B is telling administering the broad spectrum antibiotic routinely. So broad spectrum antibiotic routinely administration not reduces the VAP. Okay, so then option C, prolonged use of the sedation. No, we have to go for the sedation vacation. Sedation vacation. Okay, every time before administration of the sedation, we have to take a little gap and we have to make the patient to awake and we have to assess whether the patient is able for the spontaneous breath or not. If the patient is initiating the spontaneous breath, we have to switch the mode of the ventilator. Okay, from the synchronized and means continuous mandatory ventilator to the synchronized mode of the ventilator, where the patient also initiate the breathing and ventilator also give the breathing. Okay, according to the respiratory rate. Okay, so that is the very important. But many of you are commenting that, sir, please take classes on the mechanical ventilator also. I will include the mechanical ventilator classes, the central line associated classes, everything I will take. The important one I will teach before going to the exam. Don't you have to worry about. And pedigree analysis also I will give a glance how to solve and with the tricks and tips also, that one also I will include. So stay connected till the end and daily watch the master nursing classes, which is giving a highly quality content in the free of cost. Okay, yes. So here the prolonged sedation is not recommended. We have to go for the sedation vacation. Then comes to the maintenance of the patient in the flat position. This is the foolishness. Okay, so we have to maintain the patient at the 30 to 45 degree. Okay, means we can say it's as the semi-follows position. We can give very important. Okay, so here's the VAP care bundle, means ventilator associated pneumonia prevention care bundle. This is very important. From here the one question will came in the last Norcet. Okay, there is chance of coming question in the next Norcet also. Okay, so the first one is the elevating the head of the bed for the 30 to 45 degree. The question will come why we have to elevate the 30 to 45 degree, because the most common reason I have told, the infection is happening because of the aspiration of the content and entry of the microorganism through the ET tube. So one is the aspiration of the content. In order to prevent the aspiration of the content, we have to keep the patient in the 30 to 45 degree. It's most important. Then comes to the daily sedation vacation. Okay, as I told you people that we have to assess the spontaneous breathing of the patient by reducing the dose of the sedation. Okay, so we will not give the sedation, the patient will come to the conscious. Okay, so then the patient will try for the spontaneous breathing. Okay, so that is where we have to assess the every day. Okay, don't overload the patient with the sedation. Daily sedation vacation is the very important, and assess the readiness of the extubation. If the patient is taking the spontaneous breath, there is no meaning in the patient to keep intubated and on the ventilator. Okay, patient is ready, you can extubate, means you can remove the ET2 and you can keep the patient on its own normal room air. Okay, very important. Then comes to the peptic ulcer disease prophylaxis, where we have to give the proton pump inhibitors or the H2 receptor blockers. In the proton pump inhibitors, all people know that the regularly used medicine pantoprazole, omeprazole. Okay, so that will comes here in the proton pump inhibitors. And in the H2 receptor blockers, we are getting the ranitidine, cimetidine, famotidine. Okay, so that all comes in the H2 receptor blockers. Why we have to give this one? As I told, in order to reduce the most common reason is the aspiration. Okay, so if in case, so I am giving the this peptic ulcer disease reducing prophylaxis, means the HCl secretion will be less. The HCl secretion will be less means it decreases the risk of the aspiration. But many of you are having the wrong concept that peptic ulcer disease prophylaxis in the VAP care bundle given to prevent the peptic ulcers. No, it is given to prevent the aspiration. Is the main very important point. And secondarily, it can used for the prevention of the peptic ulcer. But primary purpose of the giving the this prophylaxis is to reduce the HCl production and to reduce the risk of the aspiration. Most important. Then comes to the, if the patient is on ventilator, means the patient is in the only one position, stable position for the prolonged duration of the time, right? So patient is in only one position for the prolonged duration of the time, means the blood may get stasis in the one area. The blood is getting stasis means the blood is stopping in one area, means there is chance of the clotting of the blood in that area. Okay, so which increases the risk of the deep vein thrombosis. So that is the reason we have to give the DVT prophylaxis also. That is the low molecular weight heparin we have to give here. Low molecular weight heparin. Okay, So here the enoxaparin will be our drugs where we can use. Okay, so the injection enoxaparin, that is the route, is the subcutaneous route, very very important. Then comes to the oral care with the chlorhexidine, very very important. Then comes to the endotracheal tube care and suctioning. Bacho, it's very important. We have to daily we have to give the endotracheal tube care and suctioning. So when we have to suction, the best one is the, whether there may be a problem or not problem, where we have to suction every second hourly. Q to H means every second hourly. Okay, and whenever the patient requires that one, means not patient demands. It's an, if the patient is sleeping just 30 minutes back, did the section, now the patient is sleeping, suddenly you hear a gurgling sound in the this ET tube, means the some secretion came and it is sitting in the ET tube, then you have to do suction again. Okay, so every second hour means no, I will do after 2 hours. Not, it's not like that. If the patient airways get blocked with the secretion, then immediately you have to go for the suctioning, most importantly. Okay, so then comes to the subglottic secretion and subglottic secretion drainage. So what happens here, look at this image, what I am drawing here. Consider this one is the endotracheal tube. Okay, so here, as all of you know that here will be our cuff of the ET tube. Okay, so here we are having the one more extra. This is pilot balloon which will connect with the cup of the ET tube, that all you people know. And here we are having the one more suction port. Okay, so here any suctions which is coming from the oral cavity. Okay, so it will get accumulates here. It will get accumulates here. If we deflate this cup, means it will go into the lung. Okay, before deflating this cup, we have to aspirate this subglottic, means below the tongue, and above this cup the secretion will be accumulated here. Okay, so this subglottic suction port, it will opening here. Look at this hole, it's opening here. If I aspirate all the content from here, then I am deflating, means there is no secretion, means nothing will go inside. So it's very very important to use the subglottic suction drainage. Okay, so nowadays ET2 will be coming with compulsory subglottic suction drainage. Okay, so then comes to the routine monitoring we have to do, and early diagnosis. How we have to early diagnosis? Okay, it is by the X-ray. X-ray is the best method. So what we can see in the X-ray, very very important things, bacho, classical thing, that is the new patchy infiltrations in X-ray. Okay, in the chest X-ray, if the patient is getting any new patchy infiltrations, that indicating that the patient is had with a, yes, a pneumonia because of the ventilator. That is what we can say, the ventilator associated pneumonia sign. Okay, and then we have to go for the confirmation with the sputum culture. Okay, and we have to see the WBC counts in the CBC, where increased WBC count will come. Okay, and in the sputum culture, the most common reason of the ventricular this one, what we can say, the ventilator associated pneumonia, there is the Pseudomonas aeruginosa also will get, come positive. So that indicates the, yes, the patient is suffering with the ventilator associated pneumonia. So early diagnosis is most important. Okay, because this is the dangerous and lethal cause of the and leading cause of the death in the hospital acquired infection. Okay, so the most common one is the COUTI. The most dangerous and leading cause of death is the our ventilator associated pneumonia, and second most common one is the central line associated bloodstream infection. Okay, so this is the very very sorry. Second most common one is the surgical site infection. Okay, the most costly one is the and most dangerous one is the, that's the central line associated bloodstream infection. Let me clarify and revise again. Okay, so most common type is the COUTI, that is the catheter associated urinary tract infection. Second most common is the surgical site infection. Okay, the third most common is not like that. Okay, one first is, second is there. Then the most costly one is the our central line associated bloodstream infection. And the most dangerous and leading cause of death in the hospital acquired infection is the ventilator associated pneumonia. Okay, so take a clarification from this one, very, very important. Then comes to the next one, infection control measures. That is the hand hygiene, sterile technique. We have to maintain entire process of the suctioning and all. Okay, so it's very important. So then comes to the next question here. Which of the following is a primary strategy to prevent central line associated bloodstream infection, or we can say this one is also as a catheter related bloodstream infections. Okay, so that is the CRBIs. So both are same only, bacho. So what is the primary strategy to prevent this one? Okay, what is the primary strategy to prevent this one? Option A is the routine use of the antibiotics. No, if we are using the antibiotic, we can treat that one. How we can prevent that one? It's an exam are asking is the how we have to prevent that one. Okay, you are telling about the treatment, so this is not correct answer. Then comes to the option B, use a proper hand hygiene and aseptic technique during the insertion of the our central line. Very, very important. So during the insertion of the central line, we have to clean the central line insertion area with a chlorhexidine solution. Okay, then we have to make it sterile, wear a sterile gloves, use all complete sterile techniques and insert the our central line. Okay, so it's very, very important. Then comes to the next point, use a unsterile gloves. It's not correct. And then next option D, use a central line dressing daily. Okay, so there is no need of the central line dressing daily. So the question it will comes on this one, it's not required daily. So let me tell the correct answer for you all here. That is, on the central line, you are having the dressings when you have to change that one. If the patient is having the gauze dressing every second day, every second day. If the patient is having the transparent tegaderm, change the dressing every 7 day. Okay, so this is the guidelines. Every second day for the gauze dressings, every 7 day for the transparent tegaderm dressings. And when we have to do immediately, means when it is visibly soiled, means if it got wet or if it got any accidentally exposed to any blood, so if it is visibly soiled, change immediately. Changed immediately. Very important. Okay, visibly soiled means change immediately. Okay, gauze means change every second day. Tegaderm transparent dressing means change every 7 day. It's most important question. So comes to the CLABSI care bundle here. Okay, just we have discussed the strategies to prevent the CLABSI. So here is the CLABSI care bundle. Very, very important. So list of the CLABSI care bundle. First most important is the sterile technique we have to maintain, hand hygiene. Okay, then comes to the maximum sterile barriers of the precautions during the insertion. While you are inserting the central line, you have to completely maintain the sterile barrier precautions. Okay, as I told, use the sterile gloves. Okay, then clean the insertion site with the chlorhexidine solution. Very importantly, then chlorhexidine antiseptic skins we have to use. Okay, which solution? In option you will be getting isopropyl alcohol also. You are getting iodine also. You are getting chlorhexidine also. Which one you have to choose? How to choose the chlorhexidine solution is the best antiseptic solution here. Okay, so then comes to the avoid femoral site. Okay, but as all of you know that, so we are having the 3 sites for insertion of the central line. One is the our jugular vein, another one is the our subclavian vein, and another one is the femoral vein. So as all of you know that, so which one is having the highest risk of the infection? That is the femoral one. How means the femoral vein is near to the our perineal area and our groin area, where it will be wet and there is highest risk and chance of the contamination and infection will be there. Okay, so always avoid the femoral area for insertion of the central line. And if you want to insert the central line, so the best choice is the subclavian one and internal jugular one. Okay, so And one more question will comes in the emergency, which one we have to avoid? In the emergency, subclavian one we have to avoid, because if you are inserting the hurry in emergency means the chance of getting the lung injury is there, so the chance of getting the pneumothorax is there. Okay, so in the infection prevention purpose, you have to avoid the femoral one, and in the emergency you have to avoid the subclavian one. So best in the emergency is the internal jugular one, very important. Okay, so you have to avoid the femoral side for the central venous insertion. Then daily review of the central line is much and very much necessary. Daily we have to review the central line. Then use the antimicrobial impregnated coated catheters. Bacho, some catheters, some central lines which we are using, which are coming with some antibiotic impregnated. Means, so on the catheter only, they are applying the medicines, so that medicine is slowly it will release us daily, and it will avoid us the bacterial infection on the our catheters. So that is what we call as the antimicrobial impregnated catheters. Okay, so here there should be a coat. Okay, one layer of the coat will be there, so that one, so we have to use here. Then comes to the proper dressing and catheter maintenance. I have told the dressing, how to change the dressing. Then comes to the routine monitoring of the sign of the infection. Very important. So what are the sign of the infection in the central line? So surround of the central line, if there is any pus, drainage, and yellow color fluid, redness and tenderness is there, so that indicates where the infection is happening in the central line. So we have to immediately inform that treating doctor, so they will take the immediate action, because it's directly causing the infection in the bloodstream, and it is a very dangerous one. Okay, so then comes to the point number 9, standardized insertion of and maintenance of the protocol. We have to maintain, and regularly we have to train the healthcare professionals, and we have to give the information related to the updates which came in that our practices on the regular basis. So it may lead to the reducing the our central line associated bloodstream infections. But almost we have discussed the almost questions. Okay, so that is most important for our upcoming exams on the all healthcare associated infections. This is the complete trending topic because of the increased risk of the infections in the Indian health system as per the recent one guidelines. So there is chance of the questions are throwing from this particular area more. So that is what in the rapid revision only I have covered all the hospital acquired infections with their care and guidelines and updates. Okay, this one will definitely help you people to choose the correct answer in the exams. Sir, in the rapid revision session, why you told everything, sir, means this is the important and very important one. That is what I have told, everything related to the healthcare associated infections. And for the next classes, just I will focus on the very important thing, and I will finish the entire syllabus that is most high yield for your upcoming exams. Okay, so this is the wind up of the today's class. If you found this class is very much helpful for you all, so please do subscribe to the channel and hit the like button. So your one like, one subscription definitely motivates us to give you a very high yield topics and contents. In the next class, what we will discuss means we will discuss these particular OT related questions and emergency related questions and ICU related questions, where the practical based questions are repeatedly striking in the exams. Bacho, again I will come with a high yield content and updated content in the tomorrow session. So all are watching this session completely till end. So yes, please do mention that we have watched it till the end. Thank you, sir. Okay, it will help us. So we will meet in the next session. So tab tak ke liye Jai Hind, Jai Bharat.